Myself, Dr. Tanvi. I'm from the medical team from Denmark.
I'm Dr. Rohit Rebello. I'm a consultant medical oncologist at Zydus Cancer Hospital, Ahmedabad.
So, cancer treatment has changed dramatically over the last decade. What breakthroughs are making the biggest difference for patients today?
So if you look at how cancer treatment has changed over the last few years, one of the greatest improvements in the treatment of cancer has been the role of immunotherapy. So if you look at malignant melanoma, a skin cancer that used to be fatal previously, where the 1 year survival was less than 25 to 30%. Now you're looking at a clinical trial that's just been published, the Checkmate 047, where nivolumab and ipilimumab were given together. You're seeing the 10-year survival of 65 to 70%. Now these kind of game-changing treatments did not exist before. So immunotherapy is one part. The next is what we call targeted therapies. Mutations, we are able to detect them and now we are able to target them. Just recently, if you look at the Crown trial data, which was published for lorlatinib, at 8 years, they have still not reached the median survival. So you're seeing stage 4 patients who are able to make it to 8 years in a particular cancer. The onset of CAR T cell therapy, which is basically used quite significantly in hematological malignancies. And we have an Indian CAR T that's being quite commonly used in our country. That is almost 1/10 the cost of what the CAR T comes from Europe or US. This has made a lot of these hematological malignancies, to survive much longer. So definitely targeted therapies, immunotherapy, CAR T cell therapies, and the research into this is really helping cancer patients survive longer.
Right, sir. And so, like many of the patients, they are aware of the chemotherapy only. So, what do you think they should know of the new options of the cancer treatment?
So in the future, chemotherapy is going to go out.
Right.
What we're going to see more and more is antibody-drug conjugates in combination with maybe immunotherapy or targeted therapies. So what are antibody-drug conjugates? Antibody-drug conjugates are basically a very smart way of giving chemotherapy. What we do is we put a chemotherapy molecule into another antibody, and that antibody will only go and bind to a particular receptor that is more common in that tumor. So basically you're using precision missiles instead of carpet bombing. That's a very simple way to put it. Chemotherapy, carpet bombs, antibody drug conjugates are precision missiles. Now definitely adding this to immunotherapy will give you a much better response, because when the cell dies and you have immunotherapy acting on the side, that immune reaction is going to be potentiated by immunotherapy. Hormonal therapies are something that we are very commonly using. Targeted therapies, like if you look at ALK inhibitors, if you look at EGFR inhibitors, and multiple different inhibitors, especially in the space of lung cancer, where so many mutations are present and multiple inhibitors have been designed, their survivals are much, much higher than what we saw 10 years back. So I think it's the patients need to know that life exists beyond chemotherapy. The side effect profiles of these newer drugs are far, far superior. Also, something very important is therapeutics. So when we talk about therapeutics, I've given you this immunotherapy, targeted therapies, and antibody-drug conjugates. The other thing is diagnostics. So there are tests now where we can avoid treating. So the TAILORx study, which tested Oncotype DX, showed that if you achieve a particular score in breast cancer after that test, we can just give you endocrine therapy. You might not even require chemotherapy. So it's not just knowing when to treat and how aggressively to treat. Now we're also starting to learn when not to treat. And this is the greatest advancement. And this is something everybody should know, especially considering that our therapeutics are moving into a much bigger space now.
So, what do you think? Is cancer becoming more treatable than it was 10 or 20 years ago?
Yeah. So in this, I would like to put this question into two parts. One is the investigation. So we are able to investigate and diagnose cancers more accurately now. The therapeutics have improved, the diagnostics have improved, PET CTs, biopsies, immunohistochemistry, next generation sequencing. All of this has helped us identify cancer as well as understand the driving force behind that cancer. It's what we as oncologists call the driver mutations of cancer. So knowing these driver mutations have definitely helped us give better therapies that are less toxic, that improve the patient's survival. Then let's look at it in the therapy point of view. The advent of immunotherapy, the advent of antibody-drug conjugates, the advent of targeted therapies, all these therapies have really improved the survival of cancer patients. So if you look at childhood cancers, the survival has improved almost doubled when you consider it from the 1980s to the current day. A lot of research has gone into it. therapeutic toxicity has been better managed today than what it used to be managed 20 years back. We have better ICUs, we have better drugs to manage adverse events. If you look at breast cancer, there's almost been a 42% reduced risk of mortality in the last 20 years when you look at breast cancer. This is all data that has been compiled and proven. So the therapy has definitely improved, the diagnosis has definitely improved, and the stories we heard about cancer being that dreaded disease that was not curable are no longer true.
And so like if you want to like bust like about one myth about cancer, what would it be?
So one important thing, these are some patient experiences that I can
Mhm.
share. Biopsies. A lot of people have this idea in their mind that if I do a biopsy, that tumor is going to spread.
Right.
और in Hindi, cancer को छेड़ूंगा तो बीमारी फैल
फैल
जाएगा.
जाए.
Now that one concept is very wrong. So if I don't have a biopsy, I do not know what tumor I'm treating because the drug that I use for each type of tumor is different. I can't treat the lung cancer with the same chemotherapy that I'm going to use for a stomach cancer. So I need to know what subtype of cancer I am treating. We have so many molecular mutations. We have so many targeted therapies against those mutations. We have scores where we know immunotherapy is going to work or not work. So, if a patient is MSI high, we know that immunotherapy is going to do very well in these patients. Now, all that data can only be compiled if I actually have the tissue. So, this one myth that doing a biopsy actually spreads the tumor is something that I probably wouldn't agree with. The next thing is that fear of being treated with so-called Western medicines.
Okay.
This is not Western medicine. This is evidence-based medicine. So when we say that this particular drug is going to create this particular response, is going to give you this particular side effect, this has been documented in a large number of patients. We know what to expect, we know how to treat the adverse events, and we know how to make that journey more comfortable, at the same time giving you a better survival, helping you live longer, and pushing you towards that journey of cure. What happens with some alternative medicines, that promise is given of cure without side effects, but we all know, being in this branch for so many years, that if you want effect, you have to accept some amount of side effects. But definitely using these targeted therapies, the side effects have drastically decreased.
Patients often remember not just what their doctor said, but what exactly the doctor made them feel. So, what do you feel like? How does empathy affect? Like, what is the relation of empathy in oncology? What do you think?
Yeah, so this is what Mary Angelou said. It's not, that how you make people feel is something that patients carry with them. So I think it's very important to make patients feel good because, it's a very bad disease. So what happens is, I always tell my patients this one very, very simple fact, that, you need to trust the person treating you. So if you look at data, there is data published saying that, where there were recordings made of doctor consultations, and the average time taken for the doctor to cut off a patient was 11 seconds. That the patient comes in, and in 11 seconds the doctor is cutting them off and then asking them questions. I think letting them express what they are feeling, because most of the time cancer patients don't come to you to get diagnosed. They've already been diagnosed. They come to you to know what to do next, because a physician, a surgeon, a gastroenterologist, all of them will diagnose the cancer. They come to you asking for answers to what can be done next. So let them speak. Let them tell you everything about their journey till then. Let them tell you what are the things that matter to them, because it's the first consultation is about earning trust of that patient. You want information that the patient will not share with anybody else, because when she has an adverse event, she might be shy to tell it to somebody else, but she should trust you that much that she will always tell you that, even however minor it is. Like even a small cough that occurs in a patient who's taking trastuzumab deruxtecan could suggest pneumonitis. Now, a lot of patients would ignore it, but she should trust you that much that any small problem, or he should trust you that much that any small problem, they will come upfront and tell you. So, building that trust, breaking those barriers, those are very important. And I think empathy plays a very, very important role, especially as a cancer physician.
Have your patients taught you the lessons that change the way you practice medicine?
Yeah, definitely. So, what matters to a doctor and what matters to a patient are two different things. So, sometimes in oncology, you treat a lot of stage 4 patients who have metastatic disease. And yeah, eventually your therapies are going to fail and eventually the patient does die. But some patients have taught me that it's that death is not my failure. It is that journey that I took them through, that quality of life that I gave them. Those are the things they actually keep on remembering and keep on repeating, even though they know the end is eventual. They want to live that life as comfortably as possible. At the same time, if I'm trying a curative therapy on a patient, in these, we do not compromise at all on our dosings, because any adverse event occurs, we are there, we'll say we'll manage it. But if I'm treating a palliative or a non-curable case, I also need to look at the quality of life of the patient, because that patient is going to be on treatment for a prolonged period of time. So it's always better to have this conversation with the patient as what is important to you, and you tell them your perspective, they tell you their perspective, and then you try to make a treatment plan that is tailored to that particular patient. Because in palliative, in stage 4 disease, taking the patient through that journey is as important as improving their survival.
And so, how does like emotional health influence the recovery of the patient in cancer treatment?
So basically, if you look at the placebo effect, if a patient believes he is being treated, there is a 25 to 30% chance that automatically, due to various hormones secreted in the body, he does tend to feel better. Giving that positivity, giving that fighting chance to the patient, and being positive about their disease is very important. Because if I scare the patient, if I already put a cancer patient into a difficult situation mentally, that patient is never going to want to take the side effects of treatment. If I motivate that patient and I tell that patient that this is a fight that you have to fight, then that patient is more willing to accept the adverse events, because he knows at the end of that fight, that patient is going to win. So that emotional well-being is very important, and it has also been proven to improve survivals. There is a trial done in 2010, published in the New England Journal of Medicine, that said palliative care can improve survival. So it was done in non-small cell lung cancer, but it can be extrapolated to almost all other malignancies. So these are the things that really matter to the patient, and these are the things that really help in their upbringing. The next, and one thing we all avoid in India, is their mental health. Lot of cancer patients, almost 25 to 30% of cancer patients, are actually clinically depressed, and these are things we actually ignore, because mental health is such a big taboo in this country. Dealing with those mental health issues like depression, as well as the stress it puts on the caregivers, is also part of the treatment journey. And having good psycho-oncologists who are able to identify these, bring it to our notice, and help us manage them medically, this really improves the entire journey of the patient. The quality of life improves, and this also shows up with better survival.
What role do family members or caregivers they play in patients' healing journey?
So I think this question is very, very important in oncology. I think compared to any other branch of medicine, I think in oncology, it is the entire patient's family who has to go through this journey, because our treatments tend to be prolonged. It requires a lot of support nutritionally, emotionally, as well as the caregivers physically being there during their surgeries, during their radiation, during their chemotherapies. So definitely, what I do with caregivers is I once send the patient outside and I have a conversation with them, because these are people who've lived their entire life with my patient. So they know the patient better than I will ever know in a 15-minute or a 1 hour consultation. So I try to understand what is the patient's mental upbringing. What do they think about their disease? What is the journey that they want? Where do they see cure coming from? So I try to understand these things from the patient's family, such that I can counsel the patient even better, and certain points which probably the patient would not be able to open up in the first consultation, certain fears. I quell those fears with the patient by getting or by dragging that information out from the patient's family. Also, explaining to them the entire side effect profile is very, very important, because they will be the ones feeding the patient, living with the patient when the patient is at home. So picking up these side effects, maintaining nutrition of the patient even when the patient does not want to eat, these are very important things that need to be spoken in detail to the patient caregivers, because their emotional and physical support during this treatment journey is what actually brings these patients out and actually pushes them towards cure. So patient in cancer treatment cannot do everything by on their own. They require a lot of emotional support. They require a lot of other support in their activities of daily living, and that can only be done if they have good support from the family.
And so, like many of the patients after their diagnosis, they are like, why me? So how do you like address such personal questions?
Even if the cancer was caused by, say, tobacco, and we all know it's caused by tobacco, blaming the patient for something that has already happened is like crying over spilled milk. I try to turn the conversation. So I try to use the whole spilt milk analogy and try to turn the conversation into, let's not worry about how we got here. Now let's worry about how we are going to move ahead from here. So then, you have to try to understand what really, they're looking for. There are some very motivated patients who said, I don't care about the side effects of my therapy. I want to get better. And then, then you counsel them about how they can get better, how they can help me in reducing the side effects by, maintaining proper nutrition during therapy, by doing exercise during therapy, by doing exercise post therapy, and how they can improve their own outcomes. So it's not about blaming the patient, because there are a lot of cancers that actually occur without any sort of exact factor. Like tobacco can directly be correlated to a lot of cancers, but there are a lot of cancers we are seeing these days that do not have a factor that can be exactly, you can say that this is what caused that factor. There's also a lot of theological problems where people think this is God's punishment, but these are things that are not true. Definitely lifestyle has contributed to the increase in cancers that we are seeing these days, but blaming the patient is not the right way to go. What has happened. We need to move on. So COVID taught a very important lesson in this, where people in the 30s, in their 20s, got exposed to a virus and passed away. People who had their entire life planned out, retirement at 40, saving money and not doing anything. I think it gives you a lot of perspective about life, where you need to enjoy every moment that you have, because you don't know what's going to happen tomorrow. So I think having that sort of this thing of not crying over spilt milk and looking ahead is something very important, and you have to believe in that so that your patients believe in you.
How do you help patient find hope even during difficult stages of treatment?
So it's very important that you don't relate patients' feelings to what the next scan is going to say. So if a patient believes that if this scan looks good, if I have a response of 100%, 50%, 70%, that means I am doing better. That idea should never be put into patients' heads. Because there are tumors like neuroendocrine tumors where the response rates are 3 to 5%, but patients live for 5 to 6 years. So you should always understand that that scan really doesn't matter. How are you feeling today? Are you feeling good? Because those scans can always be changed. Yeah, you progressed on therapy number 1. I'll change you to therapy number 2, and that's going to give me response. So never let that patient get so involved in those scans and in those evaluations. And then what happens is they don't sleep well at night. The only thing that matters for the next 3 months is my scan going to be looking better than what it looked last time. You need to treat this, like a friend would treat it, Say, let's not bother about what the scan is going. How are you feeling today? You're feeling good? That means you must be doing good. So that's what I always tell the patients. Always be positive in front of them. Keep them peppy. Ask them their problems. But after they have told you their problems and you've sorted out their problems, have that 5-7 minute conversation with them about their children, their grandchildren, when their next vacation is. Take their mind off thinking about what data sets that we require in order to develop therapies and know when to change therapies. It's about distracting them, making them feel better, taking that extra 5 minutes with them and telling them that the scans are fine, you'll do better, everything is going well. Keeping them in that positive mind frame is something that's very important.
So, and what is the role of nutrition, exercise, and mental health after the treatment?
So if you look at nutrition, right? I have the most unglamorous advice in nutrition. There is no cancer superfood. Let us be very clear about that. Nothing till date has proven that you eat this and your cancer will disappear. I try to tell my patients, what do you like eating? And they give me a list of things. I say, stick to that. Okay, add a little bit more protein, add a little bit more this, but stick to what you like. These patients have nausea, they're vomiting. I make a very phenomenal complicated diet plan. I know they are not going to follow it. Stick to what they like and supplement it where you feel it's lacking, and most Indian diets are lacking in protein. That's the honest fact of things. Exercise. So this is where data comes in. So the challenge study, which was done in colon cancer who were treated with adjuvant chemotherapy, showed a 8% benefit in progression-free survival in patients who underwent exercise for 3 years post completion of therapy. 8% is the benefit that chemotherapy gives. And now we are finding 8% benefit when a patient exercises after treatment.
Okay.
So definitely exercise has proven to reduce your risk of recurrence. There's no doubt about it. It's been proven in a randomized phase 3 controlled trial. So definitely exercise post your treatment is extremely important.
So what advice you will give to the patients who are like fearful that their cancer will the cancer will come back or the cancer will recur?
So generally during our day-to-day lives, we also have certain complaints. We get an on-off headache, your knees are hurting today, your legs are hurting tomorrow. So not every symptom means cancer has come back. So
Right.
ignore any symptom that does not last for more than 2 weeks and that's not increasing over that period of time. So this reduces a lot of anxiety. Next is the mental health of the patient. Patients are very anxious. They tend to be in clinical depression. I think taking the help of your psycho-oncologist as well your psychiatrist, right, is something that really improves the quality of life of these patients. So to remove that anxiety is very important. And generally patients get anxious whenever they feel that a scan is coming up. So they know that, oh, after 1 year I'm going to get a scan. So now 10 days before that the patient is not sleeping. So I tend to be a person who calls them in for a routine clinical checkup and I get the scan done the same day. So the patient comes thinking it's just going to be a routine clinical checkup. I send a blood investigations and I do the scan the same day. So the patient has slept well at night thinking, this is a routine checkup. I do this every 3 months. But that day, they sleep well, they come to the OPD and I tell them, let's just get a scan done. So what happens that anxiety goes away. And if the scan comes normal by evening, they know it and they're going to sleep even better after that. So, managing these anxieties of patients are something that, over a period of time, I realized that oncology is not just about the statistics. The patients who really remember you, the patients who really come back to you are the ones whom you took through this journey in a way that probably not a lot of other people would.
What does living well after cancer look like from a doctor's perspective?
So whenever I have finished treating my patients or finished curing them, like I would, want to call it, I always tell them that, if you were doing a job before this journey, I think get back to doing that job. An empty mind is a devil's playground. So you keep thinking about, is the cancer going to come back? Is the cancer going to come back? You need to be distracted. Even people like us, if we are free for more than 2 weeks, we get all sorts of, weird ideas in our head. So it's better that they go back to work. The next thing, what I already mentioned, is physical activity. I'm a big proponent of being fit. So I believe that once the challenge study has already told us that obviously it improves your survival, but I believe it's not just in colon cancer. Probably if we did trials in other cancers, it would be extrapolated to every single cancer. So being physically fit is something that is very important. Live with a healthy diet. I'm not saying go into these superfoods and all the fads that exist without evidence, but routine diet that has a good amount of carbohydrates, good amount of protein, that's a healthy diet with a good amount of legumes and vegetables. Continue taking that. Do not ever leave your follow-ups. Meet your oncologist as often as he tells you to, because he's doing it, because he knows what the biology and the tempo of the disease is. He knows when this disease tends to come back, and keeping up with your follow-ups also are very important. So living an as normal life post your treatment is something that tells cancer that you have actually defeated it, and that's something that I always encourage my patients to do.
Right. And so, like oncology being emotionally demanding, what motivated you to be a medical oncologist, and like how now you are coping with the with this burden of coping with the patients, dealing them emotionally, or see, because for a medical oncologist we have you have to deal the patients very softly from the other doctors. So like, what do you feel?
So I guess all of us practicing a particular branch in medicine were obviously inspired by one of our teachers. So this happened probably about 20 years back, where we had a medical oncologist in our college who was extremely smart, fit, had he had clarity about things. And the beauty about medical oncology is it's a very evidence driven branch. We have trials, we have data, and they're crystal clear as to what it can do, what the drug cannot do, what are the side effects, what are the responses. So this is a very evidence-based branch. I don't have to make up anything. And being someone who believes in evidence-based medicine, as well as seeing him deal with patients, it kind of inspired me to be a medical oncologist. Definitely, as a medical oncologist, you need to also be, a part-time psychologist. So you need to talk to patients, understand them, understand their feelings, take them through that journey. And from a very long time, it's something that I like to do. I, in fact, did 3 4 months in Nimans when our results had not come. I was doing my
Oh,
diploma psychiatry in Nimans too. And then obviously oncology was always my first passion. And then after the NEET counseling got through, I shifted on to oncology. But I do bring some background from that because it's for 3 months. I was actually studying psychiatry in Nimans, and that's a beautiful institute where every single case is analyzed in depth by a psychiatrist, a psychologist, a social worker. So you understand that whole concept of how the mind should function, and when the mind doesn't function the way it is, what needs to be done for it. So I'm a big believer in mental health also, and I think that I've brought it into my practice, and that's how I focus on patient well-being more than the therapy per se. Also, this is a branch that requires a lot of ethics. So this branch, you need to know that you should believe in the evidence, because there are a lot of nutraceutical drugs that people claim to
yeah.
give results in cancer, but they aren't. So you need to be very clear that you are going to only follow the evidence, and not going, your mind is never going to waver into all these nutraceuticals or other drugs that don't have any proven benefit. So I felt my personality suited this particular profession, and I've never left looked back ever since.
Have there been moments when a patient inspired you rather than you inspiring them?
I think cancer is a great equalizer. So no matter where you come from, no matter how much money you have, I think it's a great equalizer. It brings into perspective your life too. When we undergo hurdles in our life, we complain so much. So when I look at my patient, I realize the trauma that they are going through. They have to plan their chemotherapies. They have to be here. They have to leave their jobs, come and be there for the infusion, deal with these side effects, and then recover from these side effects, go back to work, continue to have a normal life. A lot of these people have children who are young. They need to take care of their children. This teaches you a lot about what struggle actually means. And the small complaints that we have because we did not have a good day today, we did not have a good week this week, all those things go into the background. I think patients by and large are very inspiring. The courage that they show to take on this particular what I would say, cancer is one of the worst diagnoses you could probably be diagnosed with. But the courage that is shown, right? I would say it's nothing less than what probably our soldiers who are fighting wars would show when fighting the enemy. The courage that I see in my patients is something that makes me stronger, that pushes me to do better, that pushes me to read more, so that I can get the best treatment. Because that, when somebody shows you that much courage, right, it makes you want to put in more effort to help them fight harder.
How do you celebrate the victories while coping with the losses?
So it's very important when cancer patients finish their treatment, right? And generally we take a picture together for them to remember. And most of my patients do take a picture with me, especially the
Oh,
international patients. They are very, very strict that before they leave the country, they always get a picture with me and the treating team. And these are memories that they cherish, and these are memories that make us also feel so happy, that they were so happy with the way we managed them, that at the end they want a picture with us. The other thing is, if whenever we are planning their a 5 year anniversary or a 10-year anniversary of them having been cured, right, we make it a very big deal. So this, what happens is, the patient also feels like, yeah, I went through a very difficult phase in my life. These people stood by me during that difficult phase. They always come for these cancer survivor meets, and they motivate these patients who are taking treatment that, no, don't lose hope. I was at your place 5 years back, maybe 10 years back, and today I'm doing everything that I ever wanted to do in my life. So giving that positivity, giving that hope to these cancer patients on treatment, right, that's something that's very important. Then the other one thing that it's quite hard for us to deal with is loss. Okay, that's something that probably you never really get better with it. No matter how experienced you are, you never really get good at dealing with loss. But at some point, I just think, did I do the best for this patient? Was there anything more that I could have done that could have changed the outcome? If the answer is no, then my question is going to be, did I make sure that towards the end of this patient's life, the patient got what they wanted to do. The patient did not die in the ICU, went home and passed away with his family. Did that patient go back home, spend the last few days with their grandchildren, and then pass away? These are victories in my book. At some point, you need to know when to let go, when your treatment is going to be more toxic than just letting the patient be at home and being as comfortable as possible. So every time there's a loss, we obviously do think if we could do better, but if we feel no, we gave our best, but the disease probably won, and sometimes the disease is going to win, I think we take it as a part of being in this profession.
What gives you the most hope about future of the cancer care?
So the development of new therapies now, mRNA vaccines, definitely in a phase 2 study in combination with pembrolizumab and melanoma, it has found to improve the progression-free survival of these patients. So this opens up a new possibility in therapeutics, where probably cancer vaccines, especially the mRNA-based vaccines, may find a role, maybe in combination with targeted therapies, maybe in combination with immunotherapy. So this opens up a new avenue where we can target cancer cells. The other thing is CAR T cell therapy in hematological malignancies has really improved the survival of these patients. Definitely, companies like yours are getting these molecules like trastuzumab,
This one.
resitican, and all the other newer EGFR inhibitors at very sustainable costs. So that factor is very important when I'm treating an Indian patient, because obviously the Indian patient will not be able to afford spending $4,000 a month on therapy. So you need to and being the pharmacy of the world, it's very good that we're now not being this place where we're manufacturing generics, but we're actually trying to get original innovator molecules that actually work quite well, and we have used the molecules like immunotherapy molecules like tislelizumab, and we know the responses are quite good. So these newer therapies at affordable prices, and obviously this forces the innovators also to bring their prices to a reasonably affordable level. This improves the access to cancer care, and this access to cancer care is what really gives me a very positive vibe that probably we are going to be able to see more and more cures in our country that we generally see only in Western countries.
So with the advent of like discovery of all the new treatment, what do you think, sir? Like the condition like cancer, will it be more of a chronic condition in the upcoming years?
It's a big possibility. Look, in chronic myeloid leukemia, by using BCR-ABL inhibitors, we have made it a chronic condition like hypertension. You take this tablet and you probably live for 20, 25, 30 years. So, the same HIV analogy, which was probably in the 90s or in the late 2000s, HIV was considered to be a, disease that would probably kill. But now we know that people with HIV, with therapy, are living much, much longer. So with targeted therapies, with immunotherapy coming into the play in such a big way, probably you are going to be seeing these cancer patients survive for much, much longer. And this possibility of cure is seeming more possible, especially over the last 5-7 years, where we have seen immuno-targeted immuno and antibody-drug conjugates giving excellent responses.
And so, like for India, if you like want to change one thing about cancer care in India today, what would it be?
So basically, cancer care in India, right? If you look at the data, so the Concord study, which was done, which analyzed the prognosis, the 5-year survival of breast cancer patients throughout the world, the 5-year survival of breast cancer patients in India was found to be around 65%, which was found to be about 85 to 90% in Western countries. Now, this 30-35% gap that we see is not because the Indian breast cancer patient has a more aggressive breast cancer. It is because the Indian breast cancer patient does not present at an early stage, because the Indian breast cancer patient does not know what a breast cancer is supposed to look like. So this gap of knowledge needs to be filled. And I've worked in public health along with IARC, and we have done a study where we're trying to assess how to bring these patients to early cancer treatment. Screening by and large has failed. Because screening has failed because here you're asking a normal individual to take their day off work, come to the hospital, do a battery of tests, pay for that when they're completely fine. So nobody understands this whole concept of how bad cancer can be. So now the whole change is to try to diagnose them at an earlier stage such that we can pick them up early. And obviously, a stage 1 cancer always has a better survival than a stage 3 cancer. So I think this is something that probably requires a lot of thought, and getting these patients in early is something that's very important.
And so, like, what do you think, like, awareness or early detection for all the cancer patients matter?
So I think awareness is a big problem. So when we did this particular study with IARC, so we did it with we used qualitative data analysis. So we did focus group discussions, we did multiple surveys in the community, and the one thing that we found consistently was there is a lack of awareness. If I do not know what disease I am looking for, why will I ever go to the hospital? So in rural areas, what people actually think is if I don't have pain, I am fine. If I don't have fear, I am fine. The problem with cancer is that it doesn't show up as such acute symptoms that make you feel like you need to go to a doctor immediately. That lump is growing; it grows to a very large size. It doesn't hurt you till you are actually in the third or a fourth stage. So this lack of awareness is a very big problem. And I was of the opinion at that point of time that why don't we include these early signs of cancer in the curriculum of schools? Yes, definitely it's important to learn about your history and your geography and all these other things and which crop is grown in which part of India. But I think it's more important to learn what a breast cancer looks like. When what is cervical cancer vaccination? How is cervical cancer vaccination going to help reduce cervical cancer? How is hepatitis B vaccination going to help reduce hepatocellular carcinoma? These were things we were never taught at school. These are things that are game changers. Cervical cancer rates in the UK have fallen by 90% after they started vaccination. India has the second highest number of cervical cancer patients in the world. So these are things that need to be thought of by our political leaders, included in the school curriculum, because that's the area where more than 80-90% of people actually go to at least a 10th grade. Maybe after that, due to financial reasons, they stop. But this is where we can increase awareness quite drastically. And I think there's a lack of awareness in this country, which is increasing the mortality in this country.
What do you think? What can be one habit that everyone should like inculcate to reduce the cancer burden? What do you think?
So this is something I tell all my patients that if tobacco was banned today in India, 50% of all cancers would reduce.
Right.
Any form of tobacco, smokeless tobacco, smoked tobacco, gutka, kaini, whatever you might call it in whichever part of the country. Tobacco is the most common cause of cancer. And I think I still haven't understood how come it's not yet been banned in the world.
Yeah.
So, the politics of it is quite complicated. Banning tobacco is something that probably would help reduce cancer risk quite drastically. And if you do consume tobacco, go on a nicotine de-addiction program where you can stop your tobacco consumption, and over a period of years, your risk of developing cancer becomes as much as the person who's never smoked. So going through that journey is also very important. Then keep yourself active, keep moving. The challenge study showed us that exercise improves survival in a cancer patient who's completed treatment. There's no reason why staying healthy, exercising would even prevent cancer from coming. Obviously, there's no data to say this, but to do a randomized study to bring out this data would probably require a patient population subset of about 1 lakh, and that's probably not going to be feasible. But it goes to basic common sense that, yeah, if it's helping cancer patients survive, it probably has some role in preventing cancer from appearing. HPV vaccination. I think the gift from every parent to their teenage boys or their teenage girls, because it's recommended both in boys and girls between the age of 9 to 12 years, get them vaccinated. This is a very common cancer today. It's something that can be prevented because it occurs because of a viral infection. So the vaccine will prevent this cancer. So these are the few things that probably are going to make a big impact in reducing the burden of cancer in this country.
So for sure, like today's discussion, like today's podcast was like it is like very very beneficial for all our viewers. So like, do you have any of the final words for all our viewers?
So the final thing that I would like to say is life is very unpredictable. So when you are live like today is the last day that you're going to live. Spread positivity to the world. Be good to people. I think being a good human being is the first thing to becoming a good doctor. So if any of you are ever interested in becoming good doctors, remember that you need to be a good human being first. Only then you can actually be a good doctor. And having empathy towards every single patient, because you remember that that person standing in front of you has come there with hope in their eyes that you are going to do something to them that nobody else can. So you have to always empathize them because they always come with a lot of frustration, with a lot of pain. But you have to always empathize with them. Give them that few minutes more. Don't be in a hurry to close the consultation fast. I think humanity is more important in medicine than anything else. And being more human is what is going to make you a great doctor and help you treat a lot more patients much better. Thank you.